miền núi và vùng dân tộc thiểu số của Việt Nam, tỷ lệ tử vong bà mẹ vẫn còn rất cao, ở mức 100 đến 150 ca chết mẹ trên 100.000 ca đẻ sống, tức là khoảng gấp 3 lần tỷ lệ trung bình toàn quốc. Để cải thiện tình trạng này, dự án không để ai bị bỏ lại phía sau, các can thiệp đổi mới sáng tạo nhằm giảm tình trạng tử vong bà mẹ vùng dân tộc thiểu số tại Việt Nam sẽ được triển khai tại 60 xã đặc biệt khó khăn của 6 tỉnh là Bắc Kạn, Lai Châu, Sơn La, Đắk Nông, Kon Tum và Gia Lai. UNFPA sẽ cùng với Bộ Y tế và Sở Y tế địa phương thực hiện dự án này trong vòng 3 năm, từ tháng 9 năm 2021 đến hết tháng 9 năm 2024. Dự án được hỗ trợ 1,2 triệu đô la từ Quỹ hỗ trợ các bà mẹ của công ty dược phẩm hàng đầu thế giới Msd, Msd for Mothers, và 810.000 đô la từ UNFPA. UNFPA nỗ lực vì mục tiêu từ nay đến năm 2030, không có ca tử vong mẹ khi có thể ngăn ngừa được, không có nhu cầu kế hoạch hóa gia đình nào không được đáp ứng, không có bạo lực trên cơ sở giới, và không có bất cứ thực hành nào có hại đối với phụ nữ và trẻ em gái, để không ai bị bỏ lại phía sau. Tại khu vực miền núi và vùng dân tộc thiểu số của Việt Nam, tỷ lệ tử vong bà mẹ vẫn còn rất cao, ở mức 100 đến 150 ca chết mẹ trên 100.000 ca đẻ sống, tức là khoảng gấp 3 lần tỷ lệ trung bình toàn quốc. Để cải thiện tình trạng này, dự án không để ai bị bỏ lại phía sau, các can thiệp đổi mới sáng tạo nhằm giảm tình trạng tử vong bà mẹ vùng dân tộc thiểu số tại Việt Nam sẽ được triển khai tại 60 xã đặc biệt khó khăn của 6 tỉnh là Bắc Kạn, Lai Châu, Sơn La, Đắk Nông, Kon Tum và Gia Lai. UNFPA sẽ cùng với Bộ Y tế và Sở Y tế địa phương thực hiện dự án này trong vòng 3 năm, từ tháng 9 năm 2021 đến hết tháng 9 năm 2024. Dự án được hỗ trợ 1,2 triệu đô la từ Quỹ hỗ trợ các bà mẹ của công ty dược phẩm hàng đầu thế giới Msd, Msd for Mothers, và 810.000 đô la từ UNFPA. UNFPA nỗ lực vì mục tiêu từ nay đến năm 2030, không có ca tử vong mẹ khi có thể ngăn ngừa được, không có nhu cầu kế hoạch hóa gia đình nào không được đáp ứng, không có bạo lực trên cơ sở giới, và không có bất cứ thực hành nào có hại đối với phụ nữ và trẻ em gái, để không ai bị bỏ lại phía sau. vực miền núi và vùng dân tộc thiểu số của Việt Nam, tỷ lệ tử vong bà mẹ vẫn còn rất cao, ở mức 100 đến 150 ca chết mẹ trên 100.000 ca đẻ sống, tức là khoảng gấp 3 lần tỷ lệ trung bình toàn quốc. Để cải thiện tình trạng này, dự án không để ai bị bỏ lại phía sau, các can thiệp đổi mới sáng tạo nhằm giảm tình trạng tử vong bà mẹ vùng dân tộc thiểu số tại Việt Nam sẽ được triển khai tại 60 xã đặc biệt khó khăn của 6 tỉnh là Bắc Kạn, Lai Châu, Sơn La, Đắk Nông, Kon Tum và Gia Lai. UNFPA sẽ cùng với Bộ Y tế và Sở Y tế địa phương thực hiện dự án này trong vòng 3 năm, từ tháng 9 năm 2021 đến hết tháng 9 năm 2024. Dự án được hỗ trợ 1,2 triệu đô la từ Quỹ hỗ trợ các bà mẹ của công ty dược phẩm hàng đầu thế giới Msd, Msd for Mothers, và 810.000 đô la từ UNFPA. UNFPA nỗ lực vì mục tiêu từ nay đến năm 2030. Không có ca tử vong mẹ khi có thể ngăn ngừa được. Không có nhu cầu kế hoạch hóa gia đình nào không được đáp ứng. Không có bạo lực trên cơ sở giới. Và không có bất cứ thực hành nào có hại đối với phụ nữ và trẻ em gái, để không ai bị bỏ lại phía sau.
Chào mừng toàn thể các quý vị đại biểu, các vị khách quý đang theo dõi buổi tường thuật trực tiếp lễ ký và khởi động dự án Không để ai bị bỏ lại phía sau, các can thiệp đổi mới sáng tạo nhằm giảm
mortality in ethnic minority regions in Vietnam. Ladies and gentlemen and distinguished guests, the signing and launching ceremony today was held by UNFPA and MSD, the leading company in the world on pharmacy and biology, MOH and DOH at Bắc Kạn, Lai Châu, Sơn La, Đắk Nông, Kon Tum, and Gia Lai. Although Vietnam has made many progresses in improving sexual and reproductive health for the people, but discrepancies and inequality remains in the access to sexual and reproductive health services and family planning in different regions. And the event today is the opportunity to launch an important project to support the government of Vietnam to improve sexual and reproductive health care and reduce mother mortality in some ethnic minorities in Vietnam. I'm pleased to introduce Madam Naomi Kitahara, UNFPA representative to Vietnam and UNFPA project staff. From MOH, Mr. Nguyễn Đức Vinh, Director of Mother and Child Health Department. Madam Nghiêm Xuân Hạnh, Senior Staff of the Mother and Child Health Department. From MSD Vietnam, we're pleased to introduce Madam Đàm Thị Hoàng Lan, Director of International Relations. Madam Nguyễn Anh Đào, Policy Managers. From Florida, we are pleased to welcome Jennifer Cox, Director of MSD Vietnam. And from New Jersey, Dr. Mary Ann Tibet and staff from MSD for Mother who will join us online. We're pleased to welcome departments of health, CDCs, and birth attendants and midwives, representatives from different organizations who will be joining us online and via UNFPA fan page. We are also pleased to welcome the president of press agencies from local and national and provincial televisions. A big applause to you all, and those who are here and those who are watching us online. Ladies and gentlemen, for UNFPA Vietnam, this signing and launching ceremony marks an important step forward of UNFPA in the effort to support Vietnam in the field of family planning and sexual and reproductive health care. And for that reason, I wish to invite Madam Naomi Kitahara, UNFPA representative, to deliver the opening remark for the event, please.
Please welcome
Vâng, xin cảm kính mời.
Mr. Nguyen Duc Vinh, Dr. Nguyen Duc Dinh, Director of the Maternal and Child Health Department of the Ministry of Health in Vietnam, Dr. Marianne Etiebet, MSD for Mothers Lead, Ms. Jennifer Cox, Director General, MSD HH Vietnam, representatives of the local authorities, healthcare providers, and village-based midwives of Bac Can, Son La, Lai Chau, Gia Lai, Dak Non, and Kon Tum. Development partner representatives, including multilateral and bilateral donors and UN agencies, representatives of the reproductive health affinity group, including international and local civil society organizations. Good morning. Before I start, I just wanted to say that for Kontum and Zalai, yesterday we had a storm. I hope everybody is safe and well. Media representatives, today we are gathered here at this landmark event to virtually launch the project, Leaving No One Behind, Innovative Interventions to Reduce Maternal Mortality in the Ethnic Minority Region in Vietnam, with a total financial contribution of $1.2 million from MSD Mothers and MSD Vietnam. For UNFPA Vietnam, this project is one of the most important initiatives as it aims at reducing maternal mortality among the ethnic minority groups in 6 provinces in northern Midland and Mountains and Central Highland regions through innovative interventions with close attention to special needs of ethnic minority women who are at risk of being left behind in the country's sustainable development process. Dear participants, Vietnam has made significant progress in improving sexual and reproductive health of the general population in the past 20 years. And Vietnam was indeed one of the only 6 countries in the world which achieved in 2015 the Millennium Development Goal number 5 on the reduction of maternal mortality. However, disparities and inequalities remain in access to and utilization of sexual and reproductive health services among different ethnicities and regions in the country. Current evidence shows that while the maternal mortality ratio has declined to 46 maternal deaths per 100,000 live births at the national level, it still remains as high as 100 to 150 maternal deaths per 100,000 live births in mountainous and ethnic minority regions, particularly in northern Midland and Mountains and Central Highlands. Among all maternal mortality cases, it is extremely high in some vulnerable ethnic minority groups, for instance, Hmong 60% and Thai 17%. It is estimated that in the northern Midlands and Mountains, maternal mortality amongst Hmong mothers is 7 times higher than the Kim mothers. More than half of maternal deaths are happening at district and provincial hospitals due to limited capacities of healthcare facilities to manage maternal complications. In addition, remote and hard-to-reach geographic locations, socioeconomic conditions, cultural barriers, and a limited understanding of maternal complications are also additional causes of higher maternal mortality. Since 2020, the COVID-19 pandemic has exacerbated existing inequalities and disproportionately affected vulnerable population groups, especially women and girls in general, and pregnant mothers in the ethnic minority regions in particular. UNFPA's modeling
Cái
analysis
phân tích mô hình
estimated
của số
that
liệu
due
ước
to
tính rằng
COVID-19,
do dịch
in the first
COVID-19 thì
quarter
trong 3
of
tháng đầu của
2020,
năm 2020,
maternal
thì cái tỷ lệ
mortality
tử vong
could
mẹ
increase
có thể
by
đã tăng
44
từ
to
44 đến
65%
65%
as a negative
do
consequence
cái
of
tác
the
động
pandemic
tiêu cực của đại
in
dịch
Vietnam.
tại Việt Nam.
This meant
Và điều này có nghĩa là
298
Việt Nam
to
sẽ có thể có
443
thêm từ
additional mothers
298
dying
đến
from pregnancy and childbirth
443 ca
in the
tử vong
year
mẹ do
in
mang thai
Vietnam.
và sinh con trong có một năm thôi.
UNFPA is
Với
very
số
much
liệu
alarmed
tốt
by
rất là
this,
quan ngại về
as
vấn
it
đề này,
essentially
vì,
meant a reversal
nó có thể
of
đảo
developmental
ngược những
gains
cái
that
thành tựu phát
Vietnam
triển mà
has
Việt Nam
achieved
đã đạt
in the
được
past
trong nhiều
decades
thập kỷ qua
in the area
trong
of
lĩnh vực sức khỏe
sexual
sinh sản
and
và sức
reproductive
khỏe sinh
health.
dục.
Pregnancy
Việc mang
does
thai
not stop
thì vẫn
in
tiếp
emergency
diễn,
or
ngay cả
in
trong các cái tình
COVID-19
huống khẩn cấp
context.
và trong đó bao gồm
Pregnancy
dịch
and
Covid. Mang thai
childbirth
và sinh
are the
con
essential
là
part of
một phần
people's
tất yếu
lives,
của cuộc sống con người.
and it should not be
Chúng ta
forgotten
không thể
in the
quên
face of
cái điều đó ngay
COVID-19.
cả khi chúng ta phải đương đầu với
We insist
Chúng tôi nhấn
that
mạnh rằng
essential
chúng ta
sexual and
cần tiếp tục
reproductive
cung
health
cấp
care
dịch vụ
has
chăm
to
sóc sức
continue
khỏe
to be
sinh sản
provided
và tình dục thiết yếu
without any
cho
interruption
phụ
to
nữ
women,
mà không bị
so as
gián
to
đoạn
ensure
để đảm
that
bảo
pregnancy-related
rằng việc phát
risks
hiện
and
và
complications
quản lý được các
are
cái rủi ro
identified
và
and
biến chứng thai
managed
sản
without
một
delays
cách,
for the
nhanh chóng,
health
không
of
chậm trễ
mothers
với
and
sức khỏe của
babies.
bà mẹ và
No
trẻ sơ
woman
sinh.
should
Và
die
không
while
một người
giving
phụ nữ
birth.
nào phải chết khi
Dear
mà
participants,
sinh ra một sinh linh mới.
In my recent trip to Lai Châu
trong một cái
province
chuyến đi
in
công tác
April
gần đây của
2021,
tôi đến Lai Châu
one of 6
vào tháng 4 năm
participating provinces
2021,
of this
thì
project,
một trong 6 tỉnh
I
tham gia cái dự án
saw
này thì
exceptional
tôi đã chứng
vulnerability
kiến
of
những cái
ethnic
trường hợp
minority
đặc biệt dễ bị tổn
communities
thương ở các cái cộng
when
đồng
it
dân
comes
tộc
to
thiểu số
sexual and reproductive
liên quan
health.
đến sức khỏe sinh sản và
They
tình dục.
often reside in such remote and
Người dân tộc thiểu
mountainous
số thì thường sống ở
locations,
những cái vùng xa xôi,
far away
cách xa các
from
cái
health
cơ sở y tế,
facilities,
thiếu các
and
nhân viên y tế
availability
có kỹ năng
of skilled
và đặc
medical
biệt là những cái
personnel,
người mà thông thạo
particularly
ngôn ngữ
those
của địa
with
phương,
fluency in local
đặc biệt là những người
languages,
hiểu về các cái bối cảnh
an
văn hóa xã hội khác
understanding
nhau,
of different social cultural
các cái điều kiện
context,
cụ thể của địa phương,
and necessary medical
và
equipment and
ở những cái
supplies
nơi đó thì các cái thiết bị
is
và vật
very
tư y
much
tế thì
limited.
vẫn còn rất là hạn chế.
Against this background,
Trong cái bối cảnh đó,
UNFPA Vietnam
Quỹ dân số Liên
highly
Hợp Quốc tại Việt Nam
appreciates
đánh giá rất
the
là cao
decision made by
quyết định
MSD for
tài
Mothers
trợ của
and
công
MSD
ty MSD
Vietnam
for Mothers và
to fund
MSD
innovative
Việt Nam
interventions
để
to
tài trợ
reduce
các can
maternal
thiệp đổi mới
mortality
sáng tạo nhằm
in
giảm
6
cái tình trạng
ethnic
tử vong mẹ
minority provinces,
tại 6 tỉnh
namely
dân tộc
Bakan,
thiểu số là Bắc
Son
Cạn,
La,
Sơn
Lai
La,
Châu in northern
Lai Châu
Midland and
ở khu vực
mountains,
Trung Du và miền núi phía Bắc,
and
và
Gia
Gia Lai,
Đắk Nông and
Kon
Kon
Tum
Tum
ở
in
khu vực
Central
Tây Nguyên.
Highlands. We will be paying
Chúng tôi
very
sẽ
close attention
chú
to
trọng
special needs of
những
the
cái nhu cầu
target
đặc biệt
population
của
groups
các cái nhóm dân số mục
and
tiêu
taking into
và
consideration
cân nhắc
unique
đến văn
cultural
hóa và truyền thống
and
độc đáo
tradition
của
of
các cái dân
ethnic
tộc thiểu
minorities
số ở Việt Nam.
in Vietnam. In collaboration with the Ministry of Health
cùng với
and
Bộ Y
provincial
tế và Sở
departments
Y
of
tế
health
tại 6
in
tỉnh
6 provinces
và các cái tổ chức
and
xã
local civil society organizations, UNFPA would deliver the project effectively to support vulnerable ethnic minority women. The signing to launch the project today demonstrates UNFPA's continued commitment to supporting the government of Vietnam to ensure the rights and choices for all, and to ensure the provision of quality sexual and reproductive health services to prevent maternal deaths, thus contributing to Vietnam's effort to achieve Sustainable Development Goals by 2030. Thank you very much for your attention.
Vâng, xin cảm ơn bà đã chia sẻ.
Thưa quý vị, trong bài phát biểu
Ladies and gentlemen, in her speech, Madam Naomi reaffirms the commitment of NFPA to work with MOH and DOH at the 6 provinces to implement the project. And now we wish to invite a representative from the Ministry of Health, Mr. Nguyễn Đức Vinh, Dr. Nguyễn Đức Vinh, Director of MCH Department for the opening remark. Madam Naomi Kitahara, UNFPA representative to Vietnam, Madam Jennifer Cox, General Director of MSD Vietnam, Madam Đặng Thị Hoàng An, MSD Vietnam, and colleague from UN agency from MSD in Vietnam and in the US. Dear leaders of DOH in 6 provinces, Bắc Cạn, Sơn La, Lai Châu in the north, and from Tây Nguyên, Đắk Nông, Gia Lai, and Kon Tum. And dear leaders of CDCs, and dear ladies and gentlemen, caring for mother and child health is a top priority of the Vietnam Communist Party and the government. Upon achieving the MDG in 2015, Vietnam is considered by the international community as a spotlight in implementing MDG, particularly the one on reducing maternal mortality and under one child mortality. And as Madam Naomi explained in her speech, we are trying to sustain the MDG results and aim towards SDGs, to achieve SDG on maternal and child health by 2030, with the goal of nobody is left behind, and to minimize maternal mortality by preventable causes. However, as you know, in the ethnic minority region, particularly in the north, we are facing unprecedented challenges, as the PM stated earlier. At the moment, we organize this launching and signing ceremony online. This is an unprecedented event because of the impact of the COVID-19 pandemic. I'm pleased to know that this morning, the new cases is down from 5 digits to 4 digits. So we have less than 10,000 cases yesterday. So again, I want to emphasize the unprecedented challenges we are facing now under the impact of the pandemic. So despite the successes, we are facing challenges as well, particularly in terms of mother and child care. If you pay a visit to Ho Chi Minh City, you understand the situation, the pains created by the COVID-19, particularly on mother and child health. So COVID-19 is just one thing. We are facing other challenges. Climate changes, as Naomi just mentioned, I'm not sure whether the people in Gia Lai, because yesterday there was a storm. Last year I and Mr. Dat went to Quảng Nam. The entire village was swept away by the flooding, 18 deaths, and until now only 5 bodies was recovered. So in that context, we still have to strive to ensure sexual and reproductive health care services are provided without disruption. So with UNFPA support, we organize mobile health care visit for the people. Yesterday, the Minister of Health paid visit to Quảng Bình, which was also hit by the flood. Electricity was cut. People have to use the flashlight to support a delivery and childbirth at night. So you can see how serious the impact of climate change can be. So there's so many challenges we are facing today. In the ethnic minority regions, as you understand, the people, they have limited awareness, and the region is very difficult to access because of its remoteness. And for that reason, we need a holistic approach tackling both the awareness of the people and also the social and economic condition. In some area, people still assume that they want to give birth at home, no infirmary at all, and they don't want to reveal their private parts to an outsiders. No outsider can attend a delivery, particularly the health staff. So if that situation persists, it's very difficult to minimize maternal and newborn mortality. Another factor is from the perspective of the health services. So the availability and the quality of health services in remote areas are still very limited, and for that reason the health sector must make greater efforts to improve the quality of our services. So all these factors combined may result in a high percentage of maternal mortality in ethnic minority region, much higher than in the Delta and for the King majority group. So, for example, the Hmong ethnic minority group, so the maternal mortality rate is 7 times higher than in King. As for the ethnic minority region records a 3 times higher rate of maternal mortality than the national average. And what we notice is that the gap has not been narrowed down in recent decades. It is sad that in some aspect we see a bigger gap in recent years. So in that context, of course, we really appreciate the support from UNFPA, from Madam Naomi, from Mr. Dat, and UNFPA staff for your collaboration with MOH. And this time we have MSD, and with the funding to support a very important project. So we have 1.2 million US dollars for 6 provinces, 3 in the north, 3 in the central highlands, and we can cover 60 communes in total. So we focus on ethnic minority region, and this is very much in line with the focus of the government and MOH and the MSD project that we will launch today. I really appreciate the innovative approaches to take, focusing on the community, on village birth attendant as the extended arms of the health sector, and to focus also on improving the capacity of health sector health staff at the grassroots level, and you're willing to consider the new initiative raised by people at the local level. And I hope these best practices can be made available and feasible and upscale to other provinces. And finally, on behalf of MOH, I wish to thank Madam Naomi Kijahara, Mr. Dat, and staff from UNFPA. Thank Madam Jennifer Cox, General Director of MSD Vietnam, and thank you all for your share contribution to leave nobody behind. And thank you, and I wish you good health. Thank you, Mr. Nguyễn Đức Vinh, and his insightful comments on the project. Now let's connect with Florida with Jennifer Cox, MSD H8 Vietnam General Director and representative from the funding body. Let's connect with Florida, please. Vâng, kính thưa quý vị, tôi
virtually today in this important signing ceremony between MSD and the United Nations Population Fund. This event kicks off a 3-year meaningful project between MSD, the United Nations Population Fund, or UNFPA, and Ministry of Health, with the shared goal to improve maternal health and reduce maternal mortality in Vietnam. As you know, the world and Vietnam is currently facing the COVID-19 pandemic, which draw attention of healthcare organizations, governments, and publics. But there are other critical healthcare challenges that remain unsolved and have been worsened with the impact of COVID-19. Globally, every 2 minutes, a woman dies from complications related to pregnancy and childbirth. Most of these deaths are preventable when women have access to modern contraception and quality maternal health care before, during, and after childbirth. This motivates MSD to continue our global initiative, MSD for Mothers, with the mission to help create a world where no woman has to die while giving life. For over a century, MSD has taken on the most urgent global health challenges, including diabetes, HIV and AIDS, and cancer. Maternal mortality is no exception. Vietnam has been making great progress towards reducing maternal mortality over the last years. Still, this ratio remains high among women in the mountainous and ethnic minority regions, particularly in the northern Midlands and Mountains and Central Highlands. There are huge unmet needs in accessing to maternal health and family planning services in these areas, which urge our action and shared collaboration. For nearly a decade, we have brought MSD's scientific and business expertise to help improve maternal health and outcomes globally. In Vietnam, we have awarded grants to deploy MSD for Mothers since 2016, increasing awareness and access to innovative contraceptive methods, safe abortions, and promoting safe birth delivery practices. We take a holistic approach to address the community factors and inequalities that impact maternal health, underscoring our company's overall commitment to reducing healthcare disparities around the world. This month, in September, globally we will mark the 10-year anniversary of MSD for Mothers. There's no better and more meaningful way to celebrate this milestone by continuing our efforts in improving maternal health and decreasing preventable maternal mortality. We are proud to collaborate with our long-standing partner, UNFPA, in kickstarting this MSD for Mothers program, Leave No One Behind, investing in innovative interventions to reduce maternal mortality in ethnic minority regions of Vietnam, working towards reaching the UN's Sustainable Development Goals. For over 25 years, MSD has been relentlessly strive to make a difference for people in Vietnam. We demonstrate this commitment through far-reaching policies, programs, and partnerships to help people in Vietnam live healthy lives. In this partnership with UNFPA, MSD will provide $1.2 million of financial support over 3 years in an ongoing effort to improve women's health and help carry out that commitment in Vietnam. Women are the cornerstone of a healthy and prosperous world. When a woman is able to plan a pregnancy and have proper maternal care, she and her family, community, and nation thrive. We believe this project will bring tangible benefits to women in Vietnam and set the foundation for communities and societies to thrive for generations to come. I would like to take this opportunity to thank UNFPA and the government experts and officials for their dedication to make this partnership come true for a better life for all of the people in Vietnam. I wish you all good health and happiness. Thank you very much.
Vâng, xin cảm ơn những chia sẻ của bà Jennifer Cox.
Thank you very much, Madam Jennifer Cox. Ladies and gentlemen, to better understand about the project, Nobody is Left Behind, innovative intervention to reduce maternal mortality in ethnic minority regions in Vietnam, let's follow a clip that we have prepared.
Mặc dù Việt Nam đã đạt được nhiều tiến bộ đáng kể trong việc cải thiện sức khỏe sinh sản và tình dục của cộng đồng dân cư chung, chênh lệch và bất bình đẳng trong tiếp cận dịch vụ sức khỏe bà mẹ giữa các dân tộc và vùng miền vẫn còn. Tỷ số tử vong mẹ đã giảm xuống còn 46 ca tử vong mẹ trên 100.000 ca trẻ đẻ sống ở cấp quốc gia. Nhưng tỷ số này vẫn ở mức cao 100 đến 150 trên 100.000 ca trẻ đẻ sống ở các vùng miền núi và dân tộc thiểu số, đặc biệt là ở Trung Du và miền núi phía Bắc và Tây Nguyên. Một nghiên cứu cho thấy, trong số các trường hợp tử vong mẹ được báo cáo ở các vùng núi, tỷ lệ này thường cao đối với một số dân tộc như Hơ Mông 60% và Thái 17%. Người ta ước tính rằng nguy cơ các bà mẹ Hơ Mông chết khi mang thai hoặc sinh con cao gấp 4 lần so với người Kinh. Một nghiên cứu khác được thực hiện tại 60 xã khó khăn nhất ở Trung Du và miền núi phía Bắc và Tây Nguyên cho thấy sự bất bình đẳng lớn giữa các nhóm dân tộc thiểu số về tiếp cận các dịch vụ sức khỏe sinh sản, sức khỏe tình dục so với số liệu của cả nước. Một số chỉ tiêu như dịch vụ khám thai, ít nhất 4 lần khám thai chỉ đạt 16% so với 74% và các ca sinh có nhân viên y tế được đào tạo chỉ đạt 49% so với 94% của cả nước. Kế hoạch hóa gia đình giúp ngăn ngừa mang thai ngoài ý muốn và tránh được 44,3% tử vong mẹ. Tuy nhiên, nhu cầu về các dịch vụ kế hoạch hóa gia đình có chất lượng vẫn chưa được đáp ứng đầy đủ bởi một số nguyên nhân chủ yếu sau. Năng lực của người cung cấp dịch vụ còn hạn chế, thiếu giám sát hỗ trợ. Nhu cầu kế hoạch hóa gia đình chưa được đáp ứng còn khá cao ở các nhóm dân tộc thiểu số. Tỷ lệ ngừng sử dụng các biện pháp tránh thai hiện đại ở Trung Du và miền núi phía Bắc và Tây Nguyên là 30%. 25% phụ nữ dân tộc thiểu số ở Việt Nam cho rằng lần mang thai cuối cùng của họ là không có kế hoạch. Cơ sở vật chất, trang thiết bị còn thiếu. Có 3 sự chậm trễ góp phần vào tử vong mẹ, đó là: 1. Bà mẹ và người thân chậm phát hiện các dấu hiệu nguy hiểm khi mang thai và khi chuyển dạ và chậm đưa ra quyết định tìm kiếm dịch vụ chăm sóc. 2. Bà mẹ và người thân chậm trễ trong việc tiếp cận dịch vụ chăm sóc khi mang thai và khi chuyển dạ. 3. Bà mẹ chậm được chăm sóc sức khỏe và điều trị thích hợp tại các cơ sở y tế do những yếu kém về cơ sở vật chất, cán bộ không được đào tạo về cấp cứu sản khoa, không có cơ sở lưu trữ máu truyền. Các nghiên cứu gần đây về tử vong mẹ ở đồng bào dân tộc thiểu số cho thấy tử vong mẹ xảy ra tại các trạm y tế xã chiếm tỷ lệ nhỏ. Một tỷ lệ lớn 47,2% các ca tử vong mẹ xảy ra tại nhà hoặc trên đường đến bệnh viện, cho thấy nhiều bà mẹ dân tộc thiểu số bị chậm trễ việc tìm kiếm sự trợ giúp của nhân viên y tế. Không chỉ ở tuyến xã, tỷ lệ tử vong mẹ đáng chú ý cũng xảy ra tại các bệnh viện tuyến huyện và tuyến tỉnh trên 50%. Điều này làm dấy lên lo ngại về năng lực hạn chế của hệ thống y tế tại vùng dân tộc thiểu số, cũng như thiếu hụt nguồn nhân lực có kỹ năng. Thiếu các nữ hộ sinh có tay nghề cao, có thể nói tiếng dân tộc thiểu số và hiểu truyền thống, văn hóa địa phương tại trung tâm y tế xã, cũng như năng lực phát hiện các dấu hiệu nguy hiểm còn hạn chế của họ để chuyển các trường hợp tai biến thai nghén lên bệnh viện tuyến 3 và đảm bảo cấp cứu kịp thời điều trị y tế thích hợp là những nguyên nhân chính gây tử vong mẹ. Sự chậm trễ thứ hai và thứ ba. Một nghiên cứu được thực hiện tại 20 huyện vùng sâu vùng xa nhất của 4 tỉnh có nhiều dân tộc thiểu số vùng Trung Du và miền núi phía Bắc vào năm 2019 cho thấy tại 80% bệnh viện tuyến huyện có bác sĩ đa khoa, không phải chuyên gia sản phụ khoa, tham gia vào xử trí các ca tai biến của mẹ. Theo phân tích chuyên sâu về các ca tử vong mẹ tại nhà, hầu hết các ca tử vong mẹ đều liên quan đến việc đỡ đẻ mà không có người đỡ có tay nghề. Vị trí địa lý xa xôi khó tiếp cận, điều kiện kinh tế xã hội, rào cản văn hóa và hiểu biết hạn chế của người mẹ về các biến chứng ở mẹ cũng là những nguyên nhân bổ sung dẫn đến tử vong mẹ. Năm 2019, đại dịch Covid-19 đã lan rộng toàn cầu, đã ảnh hưởng tới mọi mặt đời sống xã hội của Việt Nam. Vì phụ nữ mang thai rất dễ bị nhiễm virus, bao gồm Covid-19 do điều kiện sinh lý của họ và do năng lực và nguồn lực của hệ thống y tế ở các vùng miền núi còn hạn chế, cần phải tích hợp phòng chống Covid-19 vào các hoạt động đáp ứng chương trình chăm sóc bà mẹ trẻ em và kế hoạch hóa gia đình hiện có nhằm làm giảm các nguyên nhân tử vong mẹ có thể phòng tránh được. Dự án này được xây dựng nhằm mục đích làm giảm tử vong mẹ ở một số tỉnh dân tộc thiểu số được lựa chọn, chú ý đến nhu cầu đặc biệt của các nhóm dân cư mục tiêu và xem xét văn hóa và truyền thống độc đáo của các dân tộc thiểu số ở Việt Nam. Dự án do Bộ Y tế thực hiện trong 3 năm với kinh phí trên 2 triệu đô la Mỹ do chương trình Vì các bà mẹ của công ty dược phẩm sinh học MSD Mỹ và Quỹ dân số Liên Hợp Quốc UNFPA đồng tài trợ. Trong đó, MSD for Mothers đóng góp 1,2 triệu đô la Mỹ và UNFPA tài trợ 0,8 triệu đô la Mỹ. Dự án sẽ được thực hiện tại 60 xã vùng sâu vùng xa của đồng bào dân tộc thiểu số của 6 tỉnh khó khăn nhất ở Trung du miền núi phía Bắc và Tây Nguyên, đó là Bắc Kạn, Lai Châu, Sơn La, Đắk Nông, Kon Tum và Gia Lai. Các xã được lựa chọn là những xã được Chính phủ Việt Nam xếp vào loại 3, là những nơi có điều kiện địa lý, kinh tế, xã hội khó khăn nhất, nơi có nhiều đồng bào dân tộc thiểu số sinh sống. Các mục tiêu cụ thể của dự án bao gồm: 1. Tăng cường khả năng tiếp cận và sử dụng các dịch vụ kế hoạch hóa gia đình có chất lượng và tự nguyện trong đồng bào dân tộc thiểu số. 2. Nâng cao năng lực quản lý cấp cứu sản khoa ở các địa phương miền núi, vùng sâu, vùng xa. 3. Xây dựng mạng lưới cô đỡ thôn bản ở các địa phương vùng dân tộc thiểu số. 4. Lồng ghép phòng chống và kiểm soát Covid-19 vào chương trình kế hoạch hóa gia đình và chăm sóc sức khỏe bà mẹ hiện có. 5. Phát triển và vận hành ứng dụng điện thoại thông minh trên nền Internet để cải thiện việc cung cấp các dịch vụ chăm sóc sức khỏe bà mẹ và kế hoạch hóa gia đình ở các địa phương vùng dân tộc thiểu số. 6. Triển khai các sáng kiến giáo dục sức khỏe và huy động cộng đồng cho các cộng đồng dân tộc thiểu số để thúc đẩy sinh con an toàn. Tỷ lệ phụ nữ có thai đến khám thai ít nhất 4 lần tăng 20%. Tỷ lệ phụ nữ đi khám sau sinh tăng 25%. Tỷ lệ sinh có cán bộ y tế được đào tạo tăng 25%. Tỷ lệ phát hiện sớm và chuyển tuyến lên bệnh viện tuyến 3 tăng 20%. Tỷ lệ sử dụng các biện pháp tránh thai hiện đại sẽ tăng lên 20%. Các nhu cầu chưa được đáp ứng về các biện pháp tránh thai hiện đại sẽ được giảm 15%. Việt Nam có 53 dân tộc thiểu số, chủ yếu sống ở vùng rừng núi xa xôi với mức độ phát triển kinh tế xã hội hạn chế và khó tiếp cận giao thông. Để giải quyết những bất bình đẳng trong chăm sóc sức khỏe sinh sản giữa các vùng và các nhóm dân tộc, Chính phủ Việt Nam đã có những đầu tư đáng kể trong 10 năm qua để nâng cao năng lực hệ thống chăm sóc sức khỏe, đặc biệt là ở tuyến chăm sóc sức khỏe ban đầu, vùng đồng bào dân tộc thiểu số và vùng sâu vùng xa. Nhiều cơ sở y tế ở vùng dân tộc thiểu số hoặc các xã vùng sâu vùng xa hiện nay đã được nâng cấp cơ sở hạ tầng, bao gồm cả các cơ sở và trang thiết bị thiết yếu và nâng cao năng lực nguồn nhân lực, khả năng cung cấp các dịch vụ chăm sóc sức khỏe bà mẹ và kế hoạch hóa gia đình cho người dân địa phương. Để góp phần cùng Chính phủ Việt Nam với mục tiêu để không bà mẹ nào bị bỏ lại phía sau, chương trình MSD Vì các bà mẹ cùng với Bộ Y tế và UNFPA Việt Nam mong muốn trong 3 năm tới, dự án sẽ đạt được các mục tiêu cao hơn so với kỳ vọng, giảm tử vong mẹ tại các vùng dân tộc thiểu số của Việt Nam, góp phần vào sự phát triển bền vững của Việt Nam trong những năm tiếp theo.
We believe that better maternal health care is a pathway to a lifetime of good health. It's vital for a woman's well-being and prosperity, and so much more. Women are the cornerstone of a healthy and prosperous world. When a woman is able to plan a pregnancy, she and her family, community, and nation thrive. MSD for Mothers is our global initiative to help create a world where no woman has to die while giving life. We are proud to accompany UNFPA in this program, which is expected to bring tangible benefits to improve maternal health for Vietnamese women and together thrive for a better community.
UNFPA đã và đang phối hợp rất chặt chẽ với Chính phủ Việt Nam để đáp ứng nhu cầu của phụ nữ và trẻ em gái vì mục tiêu tất cả các ca tử vong mẹ đều có thể ngăn ngừa được. Các nhu cầu kế hoạch hóa gia đình đều được đáp ứng. Không còn bạo lực trên cơ sở giới và các thực hành có hại đối với phụ nữ và trẻ em gái từ nay đến năm 2030. Để không ai bị bỏ lại phía sau.
Vâng thưa quý vị, như vậy là dự án với
Gentlemen,
tổng ngân sách được
so we
chương
have
trình
just been informed that the total budget provided by MSD for mothers and MSD Vietnam will be 1.2 million US dollars, where the counterpart contribution from UNFPA of 810,000 US dollar, which will be implemented right after this event until 2024, and we hope the project will help reduce substantially maternal mortality in ethnic minority regions in Vietnam. Now it's time to witness the most important moment of this project. For the signing ceremony, may I introduce to you from Hanoi, Madam Naomi Kitahara, UNFPA representative to Vietnam. From Florida, Jennifer Cox, General Director, MSD HH Vietnam, and from New Jersey, Dr. Mary Ann Atibat. Let's join me to witness the signing ceremony. Ladies and gentlemen, from this moment, the project was officially launched. Nobody is left behind. Innovative intervention to reduce maternal mortality in ethnic minority regions in Vietnam. Now, may I invite Dr. Nghiêm Xuân Hạnh, Senior Staff from Mother and Child Health Department, to present the plans to implement the project. Dear Madam Naomi Kitahara, UNFPA representative to Vietnam, Madam Jennifer Cox, Director of MSD in Vietnam, Mr. Nguyễn Đức Vinh, Director of Mother and Child Health Department, representative from Department of Health from 6 provinces, and from CDCs, and ladies and gentlemen. In the previous session, we have witnessed the signing ceremony of the project. Nobody is left behind. Innovative intervention to reduce mothers' mortality in ethnic minority regions in Vietnam. We have listened to opening speeches about the importance of the project, and we watched a video clip on maternal mortality in ethnic minority region and the goals of the Vietnamese government to reduce mother mortality in ethnic minority region. So allow me to, on behalf of Mother and Child Health Department, MCH, to give you an outline of the project implementation plan for the years to come. So I will present some key information about the project, the expected results and activities, also the project management and coordination mechanism. The project aims to reduce maternal mortality in selected ethnic minority provinces with a large population of ethnic minority, focusing on target groups taking into account their specific cultural factors. We will focus on 60 remote ethnic minority communes in the 6 provinces, focusing on Northern Midlands and Mountain and Central Highland, Lai Châu, Bắc Cạn, and Sơn La, and Kon Tum, Gia Lai, and Đắk Nông. The time of the project is from 2021 to 2024, with a budget of 2.1 million US dollar, of which 1.2 million from MSD and 810,000 USD from UNFPA, which will be spent on training provincial trainers, developments of professional guidelines, procurements of medical equipment, fetus monitors, heart Dopplers, and PPEs. So to achieve these goals, the project identify 6 key results activity. One is to increase access to utilization of integrated quality and voluntary family planning services, building the capacity of service provider on emergency obstetric care management, village-based birth attendance, COVID-19 prevention and control, and development of an internet-based apps, and the use of IEC to raise the awareness of ethnic minority people. So for the first result, which is increase the access to integrated quality and voluntary family planning services. So at the central level, we will train service provider on planning and management of family planning services provision. At the 6 provinces, we will launch IEC campaign to increase the use of family services to meet the need for contraceptives, for example. For the result number 2, which is enhancing the capacity of service provider on emergency obstetric care, we will have 2 key set of action. First, we will train our staff on the skills for managing common emergency obstetric care, such as postpartum hemorrhage, for example, so that our local staff can reduce the complication created by obstetric emergencies. And at the local level, we will conduct analysis of reported maternal deaths to identify causes of death and influencing factors to identify further to improve the quality of care. And MCH, my department, will organize workshops so as we can draw lessons learned from local experiences in order to generalize into systemic solutions to reduce complication and improve the quality of emergency obstetric care. The result number 3, which is the development of a network of village-based birth attendants. As you can see on the video, in ethnic minority region, people still follow old-fashioned practices. For example, they refuse to give birth at health clinics or in the presence of trained, skilled health personnel. And in this region, maternal mortality rate, sometimes it's 3 times the rate at the Delta. So in that context, we have the initiative of village birth attendant, which has proven effective in reducing maternal mortality. So we train young women, ethnic minority women, with essential skills to care for people in their own ethnic group. And in the project, we expect to train 60 village birth attendants for the villages most in need. And then we will provide continuous supervision and provide them with health equipment to support them during their work, such as medical kits. Result number 4 of the project, which is mainstreaming COVID-19 prevention and control in the existing maternal health and family planning programs. We just witnessed the 4th wave of the COVID-19, which really hit hard the southern provinces. So services, particularly health services, have been severely disrupted. And in this context, the need is to mainstream COVID-19 prevention in the existing maternal health care program. And to do that, MCH department will train health staff on how to provide undisrupted health services during the COVID context. And in the fourth quarter of this year, we and UNFPA already have a plan to train instructors and trainers for the provincial level using funding from another source provided by UNFPA. We want to kickstart this action, this activity as soon as possible. Result number 5, which is the development of a mobile phone app to care for maternal health and to provide family planning services in remote areas. As you know, particularly in the context of natural disaster and the pandemic, we experience the time of social distancing, and the access to health services can be very difficult. So telehealth is an essential new solution. And in this project, UNFPA and MCH and another NGO, which is CCIHP, CCIP, will pilot MCH 247 for maternal and child health care. We will roll out the app in specific districts and communes. And after the pilot rolling out of the apps, we will assess the effectiveness of the apps for possible upscaling in other areas. The final result number 6, which is innovative health education and community mobilization. We mobilize the participation of the community for the project. So at the central level, MCH department and UNFPA will support the design of IEC materials, and each locality can modify that training materials to suit their condition. And then we will launch IEC communication campaign on how to use modern contraceptives to promote health care at health facility, childbirth at health facility. We will also support youth-led initiative on sexual and reproductive health care in ethnic minority region. So I have given you an idea about the 6 results, and then we want to give you who will be responsible for what. So MOH will provide the inputs for the project, develop training guidelines, IEC materials, standardized IEC materials, train trainers and health staff. MOH will supervise and provide technical assistance together with UNFPA through provinces and together with MSD as well. MOH will organize national workshops to draw lessons and to distribute best practices, and will work with UNFPA to raise more funds for the project. And the project management unit will support localities to implement the project and to support with financial and administrative management and with monitoring and supervision. So at the provinces, CDCs and organizations will provide services, will train and support village birth attendants to conduct analysis of reported maternal deaths to come up with better procedures. We will pilot IEC initiatives, particularly the youth-led initiative for SRH for ethnic minority. UNFPA, apart from being a key funder together with MSD, UNFPA will provide technical assistance and help with procurement of health equipment, the piloting of the telehealth apps, and conduct a baseline and analyze evaluations. And in the project, we will have the involvement of a CSO, a social organization, which is very experienced in sexual and reproductive care, which is CCIHP, and CCIP will provide technical support to the telehealth apps. So this is a chart that shows you the project management and implementation. So at the central level, we have the focal point, which is MCH department. We work closely with the PMU of the project. This project is considered as a component of a larger project, a joint project between UNFPA and MOH. So we will follow the UNFPA funded project guidelines and terms of operation. At the provinces, the focal point will be the provincial CDCs and other stakeholders such as provincial departments of health and UNFPA will monitor and support the implementation and conduct the baseline and inline evaluation. We will sign a responsibility contract between the PMU and the CDC, so every quarter we will have a planning phase and then implementation, and bills and vouchers will be archived at the central PMU, and all these planning and implementation and financial procedures will be supervised by PMU, and we will provide training to all project staff. So on behalf of MCH department, I have given you a very quick overview of the project, the expected results and the key activities and the management mechanism for the project, administrative and financial. We hope that with the support from UNFPA and the funding from MSD and the collaboration from all stakeholders, departments of health and CDCs, we will implement this project with great success and contribute substantially to our joint effort to make sure that mother mortality in ethnic minority regions in Vietnam is reduced, to narrow the gap between regions in Vietnam, and to make sure that nobody is left behind. Thank you, Dr. Nghiêm Xuân Hạnh. Ladies and gentlemen, Dr. Lý Thị Hoa, the head of administration of the Department of Sexual and Reproductive Health at Bắc Cạn CDC, want to share her thoughts as a beneficiary of the project. Let's connect to Dr. Hoa from Bắc Cạn. Ladies and gentlemen, allow me to introduce myself. I'm Hoa, Head of Administration and Department of Reproductive Health from CDC of Bắc Cạn. Allow me to share with you reproductive health care and maternal care in Bắc Cạn. This has always been a key priority in Bắc Cạn. At the local level, we advise the local People's Committee to issue a plan on reproductive health, focusing on maternal and newborns health care for the period 2021 and 2025. Every year we organize a series of activities such as a training of instructor and health staff, and building capacity for health staff at grassroots level, focusing particularly on obstetric emergencies and safe delivery. So we have increased the percentage of the numbers of pregnant women who receive pregnancy medical examinations 3 times during the pregnancy, and the percentage of mothers and newborn receiving postnatal care always reach 95%. However, the ratio of pregnant women receiving pregnancy monitoring is still low, and a high percentage of them, particularly among ethnic minority people, still prefer to give birth at home, leading to a higher risk of mother and newborn mortality. And for that reason, we really appreciate UNFPA for providing the funding for the project Nobody is Left Behind, an innovative intervention to reduce mothers' mortality in ethnic minority regions in Vietnam. We really appreciate this project for meeting the needs, particularly of pregnant women. Ladies and gentlemen, in 2020 and 2021, we receive fetal monitors and heart Dopplers from the project, and we are happy to receive further instruction from the project to enhance the effectiveness of safe motherhood and safe pregnancy in the 2 districts selected for the project to reduce mother and infants mortality, improve the capacity of the people to access health care, to access obstetric and gynecological services, pediatrics, preventive interventions, the prevention of NCDs, mother-to-children infections, towards the sustainable goals by 2030. Thank you very much for your attention. I wish all of you and the distinguished guests success and happiness. Thank you, Dr. Hoa. Now let's listen to village birth attendants and midwives who receive support from the project. Allow me to introduce myself. I'm Mati Dung. I'm a midwife working at an infirmary of a mountainous commune in Chợ Đồn district of Bắc Cạn. So we are from a very remote region, and the majority of the population are Hmong ethnic group, and the transport is then challenging because of the rugged terrain situations such as child marriage and consanguineous marriage is still common. Many people still give birth at home. So given these challenges, we really look forward to the support from the higher level so that we can face the challenges and to help the local ethnic minority people better understand the importance of family planning. I hope that we can attend training program. We can train our village birth attendants to improve the quality of our population. Good morning. I'm Jasu May, a Dao ethnic minority. I'm 38. I am a village birth attendant at Chi San village in Phong Tho in Lai Châu province. I really want to help my fellow ethnic minority people to improve their health. My wish for the funder is that I hope the funding body provide us with some allowance so that we can do our job better and on a long-term basis. And second, we hope that you can provide us with some key equipment. For example, the birth attendant kits, gloves, and clean delivery kits, and we also hope that we receive training every year so that we can learn new knowledge and skills. We also hope that our mother can receive iron supplements. I'm Nguyễn Thị Thu Hiền. I'm a midwife at the commune infirmary in Tà Bản commune, Lai Châu. about the care for mother and child. So the percentage of pregnant mother having medical examination is still low. Many pregnant mother, they do not report their pregnancy to our infirmary. And the biggest challenge is during the first 3 months of pregnancy. And this is very much because of cultural practices. Many people still prefer to deliver the baby at home, 78%. And postnatal care percentage is also low. And many village birth attendants, they do not have allowance to help them with their work. So I hope that UNFPA funded project can provide us with several forms of support. The first is the budget for us to improve the quality of the service. Second, we hope to receive more equipment for the mother and child care program. Third, we hope to receive training on healthcare skills every year. And fourth, we hope that the project can provide long-term support to our province, to Lai Châu, and to our commune, the commune of Chang'an. To continue the agenda, let's connect with Kon Tum, please. Dr. Nguyễn Thị Diệu Ánh, Head of Sexual and Reproductive Health CDC Kon Tum. Ladies and gentlemen, I'm Nguyễn Thị Diệu Ánh, Director of Sexual and Reproductive Health from Kon Tum CDC. I'm pleased to speak to you about maternal care in our province. You know that Kon Tum is in the Central Highland with a population of 500,000 people and from 30 ethnic minority groups. And we have a high percentage of poor households. And we are classified, the commune where I work is classified as a very poor commune, and for that reason there's still many challenges we encounter to care for maternal health. This relates to many cultural practices of ethnic minority people. And the maternal health care network in the province is still poorly developed. Only 5 out of 7 district has a professional obstetrician, and the majority of our district clinic are still unable to perform emergency obstetric care. And our village birth attendant, the majority of them have quit because they don't have allowance, and we have only 150 birth attendants for almost 300 communes and hamlets. So we still see many indicators that should be improved. For example, only 50% of mothers receive at least 4 medical checks during their pregnancy. Only 86% of deliveries take place with the presence of a skilled birth attendant. And in 2020, in the province, there were 3 maternal deaths, and unfortunately, all the 3 were actually preventable. So there are mothers in, for example, Tumorong districts who die of postpartum hemorrhage. Only 60% of couples use contraceptives, and at the moment we no longer have funding for the family planning program in the province, and so it's very difficult to provide contraceptive and family planning measures to those in ethnic minority regions. One of the reasons is because the state funding for sexual and reproductive health care has been cut, and so we cannot implement our activities as usual. In that context, we look forward to receive support from MOH and international organizations. And on this occasion, we sincerely thank UNFPA, Mother and Child Health Departments for your support to continue to reduce maternal mortality, and we are committed to implement the project plans and goals to help reduce maternal mortality in the time to come. I wish the success to the project. Thank you very much, Dr. Diệu Ánh from Kon Tum. Ladies and gentlemen, we have listened to beneficiary of this project, Leaving Nobody Behind. So let's have high hope that Vietnam will soon control COVID-19. Everything will be back to a new normal, and the project activity will be implemented in time. And I hope that this day, 3 years later, we can meet together to share the success of the project. Now it's time for a short talk show as part of this ceremony. This is the time for a press agency. If you have any question for our speakers, you can send your question to us via our fan page www.facebook.com/unfpa.vietnam. Now may I invite Madam Naomi Kitahara, Mr. Nguyễn Đức Vinh from MOH, to join me on the stage to discuss with the reporters and answer their questions. Thank you for joining me and for your time to reply to questions from reporters. So let's start our Q&A. So we received the first question for Madam Naomi Kitahara. So, Madam Naomi, could you explain why the project focused on 60 ethnic minority communes of 6 provinces in Northern Midlands and Mountain and the Central Highlands to implement this project? Could you put on the headphones? We have simultaneous translation provided. Vâng. Mặc dù
in Vietnam has been reduced substantially, and Vietnam was indeed one of the 8 countries in the world which has really achieved the previous global maternal mortality reduction target. When we look closely, in fact, the disparities do exist. So compared to the majority kin group, maternal mortality in ethnic minority regions tends to be 2 to 3 times higher. So that is a concern for us. We really want to make sure that equality exists in outcome of sexual and reproductive health. And there are various reasons about it. Those ethnic minority regions selected for the project are the government's type 3, which means that its socioeconomic conditions are very difficult. And also the distance to cover from household to the clinics is large. And also the capacities of the district and commune clinics are also limited. So it's important that we strengthen that. And also when we look at those ethnic minority regions, and then Lai Chau province that I visited this year, it is clear that still a lot of deliveries happen at home instead of in health institutions. and also the rate of deliveries attended by skilled birth attendant, this is very low. Something like 49% compared to the national average of over 90%. So it is important that we look at those factors which are influencing the outcome of sexual and reproductive health. And it is for that reason that we selected those 60 communes in 6 provinces of ethnic minorities that where we identified needs strengthening in terms of health sector.
Như phần chia sẻ vừa rồi của bà Naomi thì chúng ta cũng có thể thấy
của hệ thống y tế. So, as Madam Naomi just shared, so the project has a very clear goals regarding which communes should be selected, based very much on fieldwork experiences on the ground. So, with the support from UNFPA, Ministry of Health approved the National Action Plan on Reproductive Health Care, focusing on maternal and neonatal and child care. 2021 and 2025. Could you explain the role of the project funded by MSD through UNFPA, how the project will help realize?
Và như chị Nam Mỹ vừa phát biểu, chúng ta thấy
with you, we see a big gap, a discrepancy in terms of maternal and child health between ethnic minority regions and the Delta, and compare to the King majority group. And for that reason, Ministry of Health approved the National Action Plan on Reproductive Health Care. We focus on narrowing the gap, the regional gap in terms of maternal and child health care, and to speed up the reduction of the gap. And just to give you some information, 2 weeks ago, the Premier approved the program on reducing maternal and child mortality, particularly newborn child. And in this context, the MSD projects, which focus on reducing maternal mortality, which will help reduce child mortality as well. And for that reason, I really appreciate the MSD funded project. Of course, the decision by the Premier will provide state budget as well, and we now have the national targets plans on developing ethnic minority region 2021-2030. So the MSD project will contribute substantially to realizing the goals set out in our national targets program as well, and the national action plan approved by the Ministry of Health. The overall goal is to reduce maternal, neonatal, and child mortality in ethnic minority region, and substantially reduce the gap of development between region, and to make sure that we leave nobody behind. But I know that one of the key interventions of the project is to provide information on sexual and reproductive health information to young people. Why do you focus on this group? So for any country, the prosperity and the development of the country rely substantially on the young people and adolescents. So whether a country can thrive or not depends on the young people. And at the national level, we pay great attention to make sure that youth can develop both in terms of their employment, education, and healthcare. And for ethnic minority people, this is not an exception. As Naomi just shared with you, we together pay visit to very difficult areas. And young people in these areas, as you know, they're curious, and sometimes they want to try out new things. In some region, the situation of child marriage, as you see, is very common. Some get married from the age of 13 and have several children when they reach 20. So how can you make sure that maternal health care is protected in this context? So we have to raise the awareness. We make sure that the young people can access modern contraceptives and maternal health care services, and services in education and on employment. if we give them these support, we provide them with enough knowledge, I'm confident that the new generation and ethnic minority region will thrive. They will understand better about healthcare, maternal care. They have better initiative to contribute to improving the health of their own community. Thank you, Mr. Vinh. Let's connect now with Jennifer Cox, Jennifer HH Vietnam. There's a question for Jennifer. So when MSD for Mother continue to extend the MSD program in Vietnam, what are the expectations? What the program will contribute to the problem Vietnam is facing? Vâng, mặc dù Việt Nam đã
in improving sexual and reproductive health of the general population, there remains huge unmet needs in access to maternal health and family planning among different ethnicities and regions. We expect by expanding access to safe, trained obstetrician care and greater range of contraceptive methods for women in underserved areas, there is a great potential to further reduce the rate of unplanned pregnancies and unsafe birth deliveries. When we invest in maternal health, we help more women survive pregnancy and childbirth. Improved maternal health care sets the foundation for women, children, families, and communities to thrive for generations to come.
Vâng, vậy thì theo bà là những can thiệp của dự án có thể mang lại những gì?
What do you think the intervention of this project, what the benefits that the project can bring to the Vietnamese women and mothers?
Thanks for your question. The health and social complications women experience as a result of an unplanned pregnancy or unsafe birth practices can have a devastating impact on the lives of the women, the family, and their communities. MSD is proud to grant UNFPA $1.2 million to continue the MSD for Mothers program in Vietnam in 3 years from 2021 to 2024, with the goal to reduce maternal mortality in selected ethnic minority provinces. The program takes a holistic approach to address the community factors and inequalities that impact maternal health, consists of different and innovative activities to increase access to beneficiaries of family planning, modern contraception usage, improve OB care, and promote safe birth practices through enhancing capacity of service and strengthening midwifery education.
Thank you, Jennifer Cox. Vâng, ở bên cạnh những chia sẻ của bà Jennifer.
Apart from what Madam Jennifer mentioned, we have to talk about the COVID-19 impact, which affect lots of aspects of people's life. So, from the perspective of UNFPA, how do you plan to minimize the impact of COVID-19 pandemic? So this is a question for Madam Naomi.
We integrated the elements of COVID-19 in its design. When we were formulating this project, already COVID-19 was happening, so it was impossible for us not to think about the impact of COVID-19 on maternal mortality and also how to deal with it in a project design. Last year, when we did the modeling analysis of the COVID-19 impact on maternal mortality, UNFPA was very much alarmed by the outcome of that exercise, because that was essentially talking about the possibility of increase of maternal mortality by 44 to 65%. And that is a lot. And it means really the possibility of the reversal of all the developmental gains that we have achieved in the area of maternal mortality in the past decades for Vietnam. So the project had to really integrate the elements of COVID-19, and the part of it is to reinforce what we started already last year, which is the introduction of telehealth for maternal health. A lot of people with COVID-19 and social distancing programs, it's very difficult to come to the clinics. and in addition to the distance that they have to cover. And also there have been fears of making sure that they come to the clinics for antenatal care appointments and so forth because of COVID-19. So telehealth, it's basically consultation through online and a consultation using digital technologies is what the project is aiming at in terms of expanding it. We have done already the pilot phase, and the project intends to expand that so that people living in remote areas can also have the access to quality sexual and reproductive health services, and we can reduce maternal mortality.
Vâng, nói như vậy thì có nghĩa là chúng ta cũng sẽ áp dụng những cái ứng dụng 4.0 vào cái công tác chăm sóc sức khỏe sinh sản của phụ nữ và cũng như là giảm thiểu những cái tác động của đại dịch Covid-19. Vậy thì không biết được rằng là ở với cái câu hỏi này thì ông Nguyễn Đắc Vinh có muốn chia sẻ gì về phía hành động của Bộ Y tế trong cái câu chuyện là giảm thiểu tác động của đại dịch hay không ạ? Để chúng ta thực hiện được hiệu quả dự án ạ.
Tôi nghĩ đây một câu hỏi cũng rất là hay. Chị Nam My cũng đã có vừa đề cập rồi. Trong cái bối cảnh như vậy thì tôi muốn thêm một chút nữa, tức là không cứ về đại dịch Covid-19 mà cả về những cái thiên tai thảm họa do biến đổi khí hậu. Chúng ta có thể ứng dụng những cái công nghệ thông tin.
In all these situations, we should utilize technology, information technology. For example, booking appointments, allowing people to practice distancing even when they visit the clinic. If we can set up a booking appointment system, it would allow people to practice social distancing even if they visit health clinic in person. And now me just mention the smartphone-based apps. The smartphone-based apps will be a useful tools to communicate to people, to help them understand their health condition through constant advice. And now we mentioned something very important about the telehealth, and Dr. Xuân Hạnh mentioned this as well. So let's give you an example. So for example, the British pilots, without telehealth, we connect leading doctors in Vietnam, and then we collect lots of information and expertise to save the British pilots. And so that is one of the way we show that telehealth can be very useful, and I hope that everyone, particularly young people, please be supportive to MOH in terms of the utilization of future telehealth services. This is a crucial way to have our country return to the new normal. And thank you, Nguyễn Đức Vinh. He also conveyed many things to young people as well. I'm wondering if there's any further question from our reporters or on a comment box. Another question for Mr. Vinh. So how the project will address geographical and cultural barriers that can prevent ethnic minority women to use the services? So in the opening speech, I mentioned this briefly. So from my personal opinion, so I and Mr. Dart, we are entering the old age. But in the future, the how to deal with the problem in the future rests on you, the younger people, rather than us. But for the time being, what we all share, the responsibility that we all share, particularly for caring for ethnic minority people, is that the health sector must make sure that services are always available to the local communities. And we must work with local government to increase the access to the services. First, by raising the awareness for the ethnic minority people to make sure that they know that it's important to go to the health clinic, and they cannot give birth without a birth attendant, they must show up at the health clinic instead of giving birth to baby in the jungle. They cannot do that anymore. So 10 years ago, the World Bank have a initiative. So they someone who pay visit to a health clinic for pregnancy check will receive a voucher for some services and items. So this is a great initiative. And we also need IEC program to communicate to mother about happy mother who can deliver the baby safely with the support of skilled health personnel and birth attendant. So this is not just about the action of the health sector. It has to be the local government involved as well. So we also need some allowance for village birth attendants. So in the video clip, somebody just mentioned that we have the responsibility to care for the village birth attendants. They have lots of work to do, and every month they want to receive a tiny allowance. I think 200,000 Vietnamese dong per month as an allowance. They just need that much. And I really want some policy to support those village birth attendants. I think Minister of Health just make a recommendation to the government to support village-based health staff, including village birth attendant in remote ethnic minority region. And I hope with that policy, when that policy is promulgated, the village birth attendant will receive the support that they need. And that is the only way we can contribute something substantial to help ethnic minority people. Could you be more specific about the challenges that we encounter when we want to improve the qualities of the operation of a village birth attendant? So in the MSD funded project, we discussed very carefully with Naomi and with Mr. Dat that we must have a constant updates and trainings of the birth attendant. Many of them must receive advanced trainings, and we must make sure, I and Naomi and Dat, we visited a commune, and the village birth attendant in Sinh Ho, she done her job very well, but she cannot write the report, and she don't know how to connect with the local infirmary. So we must provide her with a solution so that she can report as easy as possible. So the easy reporting system for them, we cannot ask them to do a complicated report, and we have them with a better protocol for them to do their job. As Mr. Vinh explains, that there may be a problem with the connection between the village birth attendants and the health sector. Madam Naomi, how the project plans to address social and cultural barriers so that the women have better access to sexual and reproductive health?
The ethnic minority regions, there are very unique socioeconomic conditions that we have to take into account in delivering this project. So as Dr. Vinh mentioned, strengthening the village-based health personnel, this is one of the central components of the project. So the idea is also in the area of maternal health to strengthen that village-based skilled birth attendants, midwives. What has been difficult in those regions in particular is that we don't have so many skilled midwives and skilled birth attendants. And even when we strengthen at the national level the midwifery education system, often people from ethnic minority regions, they first, to start with, to recruit them is very difficult. And second, to make sure that they complete the whole education program, that's another difficulty. And so the idea is to look for that the village-based midwives and provide 6 months training for them. And many training materials will have to be translated into the local languages, but also we plan to produce visuals so that it's easier for them to understand. We have to be mindful of the fact that also the level of education is limited, and then also in Vietnam language, limited in those areas because of the school education system. For those regions, we experience a lot of dropouts, especially women and girls dropping out of the education system, and child marriage is prevalent in those areas. So we did take into account of all those factors so that it is best fit for ethnic minority regions, and they are part and parcel of the planning of activities and details of the activities, so that what we support is best fit for what they need. Thank you.
Thank you for your sharing.
Tôi xin bổ sung thêm một chút, thêm hai cái ví dụ rất là nhỏ thôi để cho nó rõ hơn cái khó khăn mà bạn nói khi mà chúng ta lựa chọn đào tạo được cô đỡ thôn bản, người dân tộc thiểu số như chị Naomi đề cập ấy. Thì ngoài cái chuyện là cái văn hóa của người ta rất thấp, tìm được người mà học được cấp 2 là đã là mừng lắm rồi. Nó còn có những cái chuyện khác mà rất là funny trong cái thực tế.
That may create barriers. So, for example, when we train birth attendants, I saw someone who dressed just like a lowland person, and I realized that so the wife was recruited for the class, but then the husband asked to come along, to tag along with the wife. So that is one of the reasons. So that's about the training. Another challenge is that many birth attendants, they quit after the wife. They say that because they receive no money, but they spend the time helping others without doing their housework, and then they are beaten by their husband. So we have to anticipate all of these challenges and barriers in order to help them. So we are those who know, who should know the challenges that these people will encounter in advance, so that we can plan our support in the most efficient way. So just want to add something to what Naomi just shared with you. So before we end the talk show, Mr. Vinh, do you want to convey a very short message regarding your expectation for the project? As I said from the beginning, I hope that MSD and UNFPA and other partners please join hands for mothers' health and children's health in Vietnam, particularly those in ethnic minority regions. Madam Naomi Kichahara, I'm sure that we will join hands to care for the Vietnamese women.
Absolutely. And as UNFPA, we believe that really no woman should die while giving life. And all preventable maternal mortality should be eliminated. So this is really the intent of this project. And with the Ministry of Health, we have been working very hard to break through on this front. And we are very happy today that the MSD for Mothers and the MSD Vietnam joined forces with us in this endeavor.
Xin cảm ơn chia sẻ.
Thank you very much for what you have shared with us, ladies and gentlemen. We understand that you will have many more questions, but because the time is up, so if you have any further questions, please email us. We will respond to you in writing. I hope that the signing ceremony and the Q&A session helped you better understand about the MSD project, as well as our responsibility, what we should do. We should join hands to support mothers in Vietnam to improve their sexual and reproductive health. I think the time for the ceremony is over. Thank you very much for joining, and thank you for those following us online on our fan page. We hope that the project will be a successful effort, and in 3 years' time, we will sit together again to share the successes we have achieved. Once again, thank you very much and goodbye.